nothing worse than having a child in dental pain. It's a lot worse when they're tired and hungry, so these are things to consider. From the age of about 6 months, the teeth come through, as indicated here, until they have 20 around the age of 2.5 to 3. At the age of 6, baby teeth at the front start falling out, and new adult teeth replace them, as well as coming through at the back. Aware of these times is quite useful, as it's what most people regard as teething, and so some Bonjela may help. Baby teeth continue to fall out until the age of around 12, when all the baby teeth will have been lost. With a combination of a poor diet and poor cleaning, the teeth can decay and chip. These can progress to what you call an abscess if untreated, and this is what it'll look like at the side of the tooth. Sometimes you can get a swelling in between the teeth. Again, it might be an abscess, but sometimes it can be food packing, and that can be painful. Cleaning out with an interdental brush may help, and it may remain uncomfortable for a couple of days because the tooth itself may have moved, being pushed by the swollen gum. Look in the adult section to see how you can place a temporary filling, although this isn't always required. Regarding the swelling in this position is far more serious at the age of 6 than it is at the age of 9 when the tooth's about to fall out. You could take a picture and email it to the dental practice for reassurance. Analgesics help a lot, but you may have to try some alternative techniques as well. However, if your child has an external facial swelling or a large internal swelling, it's almost certain they will need a course of antibiotics, and you'll have to contact your dentist for this. Sometimes the smaller swellings on the gum level actually burst, and while the swelling comes and goes, often the child has little discomfort. If the swelling has like a yellow tinge to it, it may well be about to burst, and it could be possible to encourage your child to actually burst it themselves if you apply some Bonjela directly onto the swelling and then get them to rub the swelling from the outside on their cheek using their magic finger. It could help. If the problem is due to tooth decay, then clearly the adult teeth, when they come through, have no replacements. It's essential that you get the child to get into good oral hygiene habits so this problem doesn't recur in the adult teeth.